Hi, everyone. Welcome to the Medcurity podcast. My name is Mel, and I'm hosting this episode today with a very special guest, Dr. Natasha Guess. Before we start, Dr. Natasha, why don't you start us off by introducing yourself?
Well, hi, everyone. I am Dr. Natasha Guess, and I am the founder of Guest Compliance Consultant LLC, where we help small and mid-sized healthcare practices design operational compliance systems that integrate with HIPAA and regulatory requirements. And we integrate these directly into daily workflows, helping small and medium-sized practices build structured, defensible systems so that they can grow with clarity, oversight, and with confidence.
Great. So, for many in healthcare, even healthcare organizations of different sizes, HIPAA compliance often means rushing through a yearly checklist and then having a binder of policies collecting dust on a shelf. From your view, what would you say to describe what operational compliance looks like or should look like?
So, operational compliance is when regulatory requirements are built into the daily systems, and this needs to be supported by documented oversight and reinforced through structured monitoring. For example, one of the biggest hurdles I see with practices is misalignment between what is written in their policies and what actually happens in their day-to-day operations. And let's be honest, most practices have policies, and
Yeah.
it's usually not absence of documentation that's the problem. It is sometimes caused by those operational drifts. When something changes within their practice or within their workflow, and they just let it be over time, and they don't go back when once these workflows evolve or when their technology changes, or even when they have staff turnover. But they leave those policies, they leave it to remain static. And over time, the way the organization actually functions begins to diverge from what the written policy describes. And
Yeah.
if we look at OCR enforcement actions, they frequently highlight this issue.
Mhm.
Most providers, when it comes to OCR, they have the policies. It exists, but they're not implemented effectively. And that is where gap exposure lives in compliance.
What
And
would what would you
sure.
say is the biggest hurdle when you do see that the written policies are not I mean there's that drift, like what would you say is the biggest reason for that? Or I mean we know healthcare, it's they're focusing on patients and they have a busy day and it's a lot, but like what would you say when you're meeting with clients that is often the reasoning that they give you?
Their reasoning is always, it's okay, they are busy with their patients, they're busy with scheduling, with billing, they're busy training staff or new staff when they come in. So they're taking care of all of this stuff for their practice. And then, they find a way to do things a little easier, which causes
Mhm.
that drift. And they tend to forget to go back and update their policies to reflect what they've started to do.
So, when do you go on site into healthcare practices? Because I'm thinking like when you walk into, or if you were to walk into a healthcare office and you're kind of keeping an eye out for different signs that their compliance culture is drifting, what would stand out to you?
So I've been in a few practices, and one of the first things that stood out to me with one in particular is that they did not have their notice of privacy practices up
Hmm.
anywhere. And that is one of the biggest things with HIPAA. You must have your NPPs, and your patients should be getting these either at every visit or when they start with your practice. And I find that a lot of times I'll walk into an office and there is no NPPs anywhere. And I've even
And that's an
asked
easy
one,
fix, right?
yes, it
Isn't that
definitely
that's the
is.
upside. That's an easy fix.
Yes. I've even asked the provider, one specific provider, and he was a chiropractor, he is a chiropractor, and he said to me, "Well, my practice is wide open, so I do not need to do this." And I said, where did you get that information? So I went
Yeah.
into the regs and, I pulled it up and I gave it to him and I'm like, I really hope that he fixed it.
Yeah, yeah.
But that's one
I've
of the
I've
biggest
noticed that
issues.
too. And you know what? I think, you and I, we work in we specialize in this in HIPAA compliance, and so you definitely have an eye for it. And I can tell you, just even in my day to day, if I'm looking for a provider and I walk in, I look out for that and I read the policies, and I'm like, oh, do they have it? If they don't, then it kind of makes me hesitate because I think of the rest of their HIPAA compliance, and their security. If this is missing, what else is missing? So as far as figuring out what's missing, how can whoever is in charge, like say, the compliance officer, how can they kind of spot the patterns, or where should they start?
Well, most compliance leaders, they should, if it's a small or medium-sized practice, which we're speaking of, it's usually the owners that are doing the compliance work
Hmm.
or maybe a manager. So I think what they need to do is focus on things like the HIPAA security rule. You look at your risk assessments. You look at findings within
Hmm.
OCR because there's so many enforcement actions. If you
Yeah.
look at those things, it kind of points you into the direction that you should be focusing on with your own practice.
Yeah, that's a very good point. I think I've heard it referred to as the OCR wall of shame, but I would
Yes.
say that I would say you could call it that, but you can also call it a wall of learning lessons. Like, what are the takeaways from that? If what patterns are we seeing? The and one thing that at our side on the Medcurity team, what we notice is that the lack of SRA, a lot of those big fines that the OCR has, I guess I don't want to say doled out, but requested from the organizations that they've audited. A lot of them specifically mention that this organization did not do their security risk analysis. Had they done that, XYZ would not have happened potentially.
Correct.
Um,
Yes.
yeah. So speaking of fear or fines, when some organizations, to get their team to comply with the HIPAA rules, or however they've been trained, they'll lead with fear. And where do you stand on that? And why do you think that's the approach many take?
See, for me, that is the wrong approach. And yes, in every business, fear, you can tell that fear will suppress reporting.
Mhm.
And fear-based compliance actually increases risk
Uh-huh.
because it suppresses transparency within your organization. And those organizations, when they rely on intimidation or what I like to call the gotcha mentality,
Uh-huh.
their staff will always stop raising concerns. And as we know in compliance, early reporting is everything. So if you have staff that actually sees all of the mistakes and the concerns early on and they're not reporting it, then those small issues that they see will become major exposure events.
Yeah, that's true, especially when it comes to security. The sooner those are reported, it's because the phishing emails are getting so convincing. I mean,
Yes.
it kind of makes you hesitate to click on anything any links in an email. But if you leave by fear, how many of the folks on your team are not going to say anything if they accidentally download a malicious file? You know,
Yes.
it's
But fear-based compliance, everyone tends to just pull back and they're all about, okay, this happened. I know I should report it,
yeah,
but I am not reporting that. I will get
yeah.
into trouble. I'll be written up. And that does not work in the long run for compliance.
Yeah. And we already have a workforce shortage in healthcare as it is. I know many offices are short-staffed, and the last thing you want is to have higher turnover because of the loss of employees due to compliance uh, mishaps. Um,
Yes. Yes,
so if we're
I have looked at research, especially on patient safety, And the research consistently shows that fear of blame is a primary reason why near miss events go unreported. And if you look at it, it's not really just a culture issue, that's also a risk multiplier.
Yeah, and I think it's easy, especially for clinicians. Their focus, ultimately, the reason why they're there is to take care of patients. So that's where their focus is going to be, and understandably so. So if there's that small little compliance issue, they might not even feel the reason to say anything because they're rushing and they have something more important to do.
That
Um,
is correct, yes. And at times they forget because they're so busy, they
yeah,
do forget.
yeah. So for the practice managers, so many of them feel very overwhelmed. We know that they're wearing many hats, like many folks. Um, where would you suggest they focus first to get the highest return on the time that they spend on the compliance related activities?
What I always tell practices is that they need to look at enforcement trends. That's one of the areas where the data will tell you exactly where real exposure is.
Hmm.
And what we've seen over the years is that right of access is one of the most enforced area. There's dozens of settlements that have involved either delayed responses to patient requests or improper denials or even failure to provide electronic copies in the format requested. And if you look at that, they're not necessarily complicated legal violations. They are workflow breakdowns. So between that and the security risk assessment, that is another important one that they need to work on and ensure that they have this. So the HIPAA security rule requires a documented ongoing risk analysis.
Hmm.
And yet many of the organizations they either do not have one or they have not updated one in forever. So if those organizations get a breach and OCR investigates, one
Hmm.
of the first documents they'll ask for or request is the risk analysis.
Hmm.
So if an organization does not have that, if it does not exist, that'll immediately escalate the organization's risk profile. So if I had to prioritize for maximum compliance return on effort, I would focus on three things. The first being a documented and updated security risk assessment, a
Hmm.
clear access management with role-based permissions, and then a structured right of access workflow with tracking and deadlines. And I know when I say that, providers are sitting, they're saying, well, we don't have the time for this.
Yeah.
But it doesn't have to be complicated.
Hmm.
Just a simple document, an Excel spreadsheet that you're tracking patient record requests, and you have the submission dates, the response deadlines, and the fulfillment status can prevent an organization from getting a six-figure settlement. So I would focus on those three things.
Yeah, yeah, thank you. And I think it just even like the key word that stood out to me when you t also talked about this was ongoing, and just having a plan in place. And once you have that, then you can continue with that same plan, just making those updates as you go along. Like if you were to think of the templates and things like that, like the template for business associate agreement contracts, that you can just continue to make changes so you don't have to reinvent the wheel every time, right?
Yes.
Um, yeah.
OIG, if they have so many different templates, there is no reason not to have one.
Yeah, and that's probably what the OCR would point out if if they were to investigate somebody. Hey, there's so many resources out there. You don't really have an excuse anymore. Uh,
Correct.
as much as we would like to, or people would like to come up with something, there just isn't any anymore at this point.
There is not. There is way too many things out there to help a business that just coming up with an excuse will not work anymore.
I know you work with a lot of small and mid-sized clinics, and I'm sure many of them feel that they need an enterprise budget to effectively manage it. So we've talked about the templates, but what are some other suggestions so that they can build a program? Like, say there could be there maybe there's a small practice who hasn't built one at all, and then there's some that maybe have built one that's collecting dust. Um, Maybe we start with what would you suggest for the one that the practice that didn't know that they needed to conduct an SRA?
For those practices, and a lot of my clients that I work with, they are startups, and that's why they reach out to ask the questions and to get the clarity around compliance. And for most small and mid-sized organizations, I know they often assume that they need that enterprise level budget to be compliant, but they don't. Compliance is not about spending. It is about governance, it's about operational alignment, and it's about evidence of oversight. And if you look at the HIPAA security rule, it uses the language reasonable and appropriate, meaning those safeguards should be based on an organization's size, on their complexity, and on their capabilities. That specific standard is built directly into the regulation. So when I talk to providers, my advice is regulators do not expect a five provider practice to look like a national health system.
Hmm.
They expect proportional governance. And
Okay.
if you look around at all of the recent enforcement data, this is supported with the data because it's right there from the HIPAA security rule. And I think a lot of practices, they hear about this and they're losing their minds thinking we need to get this and this in place and it needs to look like like what it looks like in a hospital. It does not.
Yeah, and to that point, if there's, say, a practice manager and they're telling the owner of the practice, hey, we need to do these things in order to be compliant, how can they get buy-in from the owners? Yeah, what
Well,
would you
one
say?
of the things with compliance is that it starts at the top. You have to have buy-in from whoever's at the head of the organization, of the practice. And the best way that I have seen is getting the enforcement data, presenting that data to that person, ensuring that they understand these are the risks. And if these are not fixed, then we can be fined, we can be put in a cap, we can lose our Medicare, Medicaid buy-in, we can lose a lot, we can lose our reputation, and we can lose our practice.
Yeah.
So it needs to be presented in that type of way with evidence. And I know for most owners, evidence is key.
That's a good point. So, what kind of questions do you get often whenever you're meeting with your clients? Like, say the top three questions that they ask.
And this will be funny for you. The first one I always get is, what is a BAA?
Oh, yeah,
And
we get that too.
yeah, and I've dealt with practices that have been in business for years and they're asking me this question. And, then I sit and I explain it to them and we pull the contracts and we take a look. And some providers, I even ask, well, you have this third party vendor. Where's your contract? Sometimes I get, well, they did send us a contract, but it was too long and I did not want to read that. So it's
Oh,
usually the BAA, the contract.
yeah.
And let's see, what's another question that I get a lot? Oh, one of the questions is, if we've never been audited, why do you think we need compliance?
Oh, that's a popular one. A lot of small practices think they think that they're not going to be like fished and they're not going to have a ransomware attack because the threat actors don't care about them. They're too small to be worth their time. Guess what? There's AI. The AI tools,
Yes.
for better or worse, they can be used for security and helping strengthen your monitoring, but they can also be used by threat actors and the small practices. I mean, that's definitely a myth there. And speaking of the business associates, there's the third party risk. That's a huge one. And in this past year, I believe there's a 40%, um, 40% of the breaches were tied back to the business associates. Um,
Yes, that
I'll
is
have to
correct.
so it's so important to have those contracts in place. And just to mention to everyone who's listening who might not know what the BAA is, it's the Business Associate Agreement, and that's a contract with your third party vendor who's handling any of your PHIs, so like your billing companies, and that sort of thing. So, um, and what would you say, like the third most common question or myth that we can bust here?
So, one myth that I get over and over and over is about we have policies, so we're compliant. Okay, yes, policies are important.
Yeah.
And I have to remind providers that policies alone do not create compliance. The implementation of the policy does. And in enforcement data for OCR, one of the most consistent pattern is that organizations, they had policies in place, but they failed to operationalize them. So when I look at that and I get that type of question or that saying from a provider, I tend to ask them, okay, you have your policies. Does your actual workflow match what your policy says? Can I speak with one of your staff and ask them how to do this process without them having to go to a workflow and look at that? And
Yeah,
that's where a lot of times you see that light bulb go off in their head because they have the policies and they have it, it's sitting in a binder on a shelf somewhere, but they're not following the policies in their day to day. And
yeah,
if something happens and OCR decides to, or any regulator decides to do an investigation, they're not going to ask a provider, do you have a policy? They're going to ask, or they're going to say, show me how it works in practice. At
yeah,
that point, can you produce those logs? Can you demonstrate your timelines? And can you show evidence of training and oversight to match those policies? So, having any type of policies without documented implementation, that creates a false sense of security for organizations. And with that type of false confidence, exposure will always begin.
yeah. And the OCR, if you have these written policies and you're not doing anything about them, it's they're going to view it as if you didn't even have them at all because that's not demonstrating a real what they call good faith effort to mitigate risk and have treating it as an ongoing process rather than a destination, and that's what they're expecting, that demonstratable proof.
Yes,
Um,
that's correct. I've spoken to many providers. I think once you ask the questions
mhm,
and you explain that in an investigation, your staff needs to know exactly what's going on and it has to be consistent. I think
mhm.
for some of them, if not most of them, the light bulb goes off.
What would you suggest as a cadence? Because there's a lot of challenges and gaps that we've addressed it, but then also if we're thinking of how do we address this? So how do we have these policies? How do we make sure that there's evidence that they're being followed and that the team understands what's going on? And if there were an audit, what should a healthcare office do that's feasible for their environment?
For most practices, and I'll speak from a small and mid-sized level, just because that's the clients I work with,
Hmm.
what I've suggested is do a 15-minute compliance rhythm weekly,
Hmm.
every week. And that rhythm is you're picking one specific area in your practice, you're reviewing the documentation, you're reviewing training, just one area every week, just one area. And by doing the 15-minute rhythm weekly, you start to see a trend. You start to see where training is lacking, where reinforcement is needed, where a policy is not actually working the way that the operation says. And I think by doing that weekly check in,
Hmm.
and talking to your staff and just having a staff meeting and discussing it. That starts towards, well, that leads them towards the right area where they need to be. And
I love
sometimes,
that idea. It breaks it down. It makes it so much more feasible, and I think it keeps it top of mind too if they're doing it at a weekly
yes,
cadence.
it does. I know some providers, they're like, okay, we need to do this annually, we need to do this quarterly, but no, take 50 minutes in 1 week, one specific area, and you go through it. You go through it with your staff, you explain it, and you'll start to see where the patterns are.
Hmm. Yeah, and then you can spot if there's any gaps or if, hey, this doesn't make sense to, maybe your team says, oh, that's what we're supposed to do. Oh, I can't. We don't have, or maybe we don't have that computer anymore, or whatever it is, we don't
Yes.
use that system. It can find those gaps too.
Yes, that's exactly how you find the gaps. And by doing so consistently, you're also providing evidence that you're aware of your risk, that you're trying to fix your risk. You'll have all of that evidence. As long as the providers remember that they need to document it, you have to have a log.
Yeah, yeah. I'm curious. There has to be, so if they put it on their calendar every week and then they have a record of it, just who was there, what time, and what they talked about, or what they actually reviewed that time, maybe like timestamps. What would be the best and easiest way to document?
I would say have a calendar invite for you and your staff. And then get a tracker, even if it's as simple as an Excel spreadsheet. You're
Mhm.
tracking your dates, your times, who attended the meeting, and you sign off on your log. Just having that helps. They do not need anything complicated, especially
Mhm.
small and medium sized companies that do not have all of the resources. Just something as simple as logging all of the information and ensuring that when you find a gap, that you
Mhm.
start correcting that gap.
Yeah, that's it. That's another really good point is making sure that you're doing something about the problem areas that you've identified.
Yes.
Because it's not, it's definitely not helpful if you just continue every week, oh, here's a problem, here's a problem, here's a problem, and then there's no record, because then it just shows that you're increasingly aware of these issues and doing nothing.
Yes.
And I feel like, we've talked about a lot of these questions and myths. I feel like there could be a whole episode dedicated to myth busting.
Oh, definitely. Yes.
Yeah. Um, let's see, maybe one last um, myth or misconception as far as HIPAA goes, or just what the OCR expectations are.
I think one of the things that I hear about a lot is that, okay, we're now in the digital world. We're doing remote care. And then I have practices that they're like, well, now that we're doing all of this, I'm sure something has changed with HIPAA. And it's not necessary, it's not a myth, but
Yeah,
I always get that question. Something has changed with HIPAA. We're now in the telehealth world. How can you help me get this fixed?
yeah,
And for me, I do have to remember that most of the times these practices, they're so busy with everything else that they do not have the time to sit down and review regulations. I
yeah.
understand that. And, I
Well,
have expl
there's so many pages and so many uh I guess vague sounding um explanations, or there's those
yes,
gray areas I think a lot of people have confusion about.
that is true. That's definitely true. And I do have to remind my clients that yes, things have changed with the digital age, but
Mhm.
HIPAA's core principles, they have not changed. Um, Privacy, your safeguards, your minimum necessary, breach notification, they're still
Mhm.
the foundation for everything. What has changed, though, in the digital world is the exposure points.
Mhm.
And as we know, as care has shifted to digital and remote environments, breaches have also shifted. And I've been reviewing OCR enforcement and OCR breach data, and it has shown that the overwhelming majority of reported incidents now involve electronic protected health information. And A lot of those breaches, they stem from remote access vulnerabilities. They stem from lost or stolen devices, and they stem from third-party vendors, like you were saying earlier. So
Yeah.
providers need to look at it in a way, in this way, actually. Remote care expands your compliance boundary. That's how they have to look at it. And it's
Mm.
no longer just about what happens inside of the four walls of a clinic. Now we have, now it includes telehealth platforms, their cloud-based EHR, their email communication, and their remote staff access. Now, many providers have virtual assistants. These are all things that are in the breach report data.
Yeah.
So providers should think of it as, now that we have a digital world, we need to understand where our data flows and who touches it, not just
Mm.
where we have it stored.
Yeah,
Yep.
and just because a app or system says that it has HIPAA compliant on the label, it doesn't mean that it's automatically, if you just download it or use it, that you're using it in a HIPAA compliant way. You have to configure it correctly and use it correctly. It's not just inherently compliant, you know. Um,
Yes. And that's why I am all about research. I tell my clients, do your research. I know they're busy. I know they don't have the time, but sometimes just that little research, they'll explain to you about these apps. And something as simple as, I know we really don't like it, but ChatGPT. You can ask
oh, yeah,
ChatGPT about an app and it'll tell you,
yeah,
but
yeah.
with
You
that,
know,
you still have to do your own research.
exactly. Yeah. And you know what? I actually use sometimes I'll like I could just be browsing a website and there's a policy and it's I'm scrolling. Sometimes I'll just copy paste the terms of use into Gemini and I'll ask it, tell me what the key points are, tell me what the upsides and downsides of this policy are, and if it depending on what it says, I'm like, okay, I don't want to download that app, or this is a non-healthcare related example, but if you were to copy paste TikTok's privacy policy into Gemini or ChatGPT, you'd be surprised at what it would say as far as how it handles your data.
Oh,
Um,
yes, definitely. And I just wish more organizations take a look at that,
yeah,
especially these small practices.
yeah.
Just putting that information in there and, like you said, just asking it to summarize this for me. And it'll do
If you're
it.
not gonna do something at all, it's better to do that. But I mean, it's also
Yes.
important to read through it yourself, of course, because
Yes,
you want to,
exactly.
you want to, it's important. But if you're not going to do anything, at least do that little piece, just copy paste and,
Yes,
flag a
and
couple
see what comes
items, if
up.
anything.
Yes,
Yeah.
definitely. I'm all for research. I love
Yeah.
research. And I hope everyone can be like that, that they want to research everything, but that's not the case.
Yeah, there's just even just thinking of like how many cookies banners you click through on a daily basis, just
Yes.
browsing online. It can be overwhelming. So it's understandable that people don't feel desire to read through the legalese. Um, but
That's
yeah,
why they
it's
have
still.
people like you and I.
I I can't even tell you how many privacy policies I've actually just read word for word. Just just even in general, like not even always healthcare related, just because it's interesting to see what, especially related to data handling. Um,
Yes,
you know, I know I'm a marketer, but I'm a very in tune with privacy. So
you have
let's,
to be.
yeah. I mean, just with more and more digital tools out there, our footprints just increase so much, and that's kind of, you have to think about it's going to be the same way in healthcare with patient data. The more and more devices that are connected together with telehealth, we have the EHRs and just the how everything's connected together. It's important to be aware of that, and of course, as you know, the way PHI flows and who has access and all of that. Um,
Yes.
so before we wrap up, what would you say like big takeaways, or is there anything that you'd like to add for our audience to leave with before we wrap up?
Sure. I'd like organizations to remember that compliance is not about checking boxes. It is about building systems that protect people and preserve trust. And when your structure aligns with your daily operation, your risk will decrease. And then leadership can make decisions with clarity. And when you have strong compliance that's intentional and consistent and embedded into how your organization runs, then trust will come easily. And if your organization is working through how to operationalize that structure in a practical way, that is exactly the work that many compliance consultants do. So you can always reach out and have a conversation with someone in compliance.
But thank you so much. That's a great advice. And to everyone listening, you're not alone in your compliance journey and your security journey. There's a lot of great resources and people out there to help you. Medcurity, you have Dr. Natasha. Just don't put your head in the sand and try and forget about it. It's important to take action.